What are some possible negative side effects of having wisdom teeth removed?
So the question is, what are some possible negative side effects of having the wisdom teeth removed? The only risk of, I shouldn't say the negative side effect, or I should say possible risk of getting the wisdom teeth removed. Anytime we are doing any type of surgical procedures in our office, my patients ask me, hey, what are the possible complications that could happen by removing the wisdom teeth? And I'm going to tell them, well, there are like about 20 or 30 different things that could happen: pain, swelling, infection, jawbone deterioration, and you may end up going to the ER, or you may get some bleeding, and all of those. Like, there are multiple things could happen, and the odds of this happen is very, very unlikely, particularly if you're getting a procedure done in a specialist office like us, or an oral surgeon, or a periodontist, or a dental implant specialist, and the odds of any type of complications happening is very unlikely. But there are possible complications that could happen. One of the most common things that most patients are afraid of, they're like, I want to classify those complications as a short-term and a long-term. Short-term, most people, whenever they're asking, hey, I heard about dry socket, you could have a dry socket happen, and so what are the odds of that happening? So be it. Like, if you did have a dry socket, there are means to treat it, and you're going to get, you're going to probably be having a little bit of a longer recovery than any other patients, and you're going to be fine. If you had pain, infection, fever, bleeding, all those things are very easily manageable. That's mostly not a problem at all. One of the most common problems that we come across, and that's a little bit of difficult to manage, is the nerve injury after the wisdom teeth removal. So some patients, if the wisdom teeth are kind of wrapped around the nerve, or the nerve is too close to the wisdom tooth that being removed, or sometimes accidentally things can happen, and for some unknown reasons, or just from injecting the local anesthetic or injecting the numbing medication. So you may have some altered sensation to your lip or the chin, or maybe even some altered sensation to your tongue, which means you may have some numbness on your chin or the lip or the tongue. For most patients, again, this numbness may be temporary. About 99% of the time, the numbness kind of goes away. On less than 1% of the time, this numbness stays permanently, depending on the age, whether you have any other higher risk, or how close those wisdom teeth were, how proximal those wisdom teeth were to the nerve. So there are multiple reasons why it happened. Sometimes, like I said, for unknown reason, this happens also, just from injecting the numbing and other sort of things. So those are some of the side effects that I can think of, what we call it as the complications. Not necessarily it is going to happen on every single patient, and not that something I would guarantee that there is not going to be any complications at all, because any complications can happen to anybody. So one of the most common things that we kind of like concerned about, which sometimes become permanent, will be the nerve damage. But other than that, most of the problems are very easily manageable, and I don't think you should be worried about whether you are at risk of having any type of nerve damage. And that's a great question, and you should be talking to your surgeon, or you should be talking to your dentist about that, whether you're at a higher risk compared to anybody else. And I hope that answers your question. Thank you so much.
All right.